So after 6 hours, 95% of the collagen hydrolysate is absorbed in the bloodstream. So after 24 hours, you find it at the relevant places in your body, like the knee. How can we state it? The reason is we made animal tests. So we feed mice with collagen hydrolysate radioactive marked 14C atoms, so to say. So we feed it with that, with that collagen hydrolysate. So, and what we found is that exactly these collagen hydrolysate molecules found after we investigated the mouse, especially in the knees, in the relevant bones, in the relevant places. So from that point we can say that really the material is transported within 24 hours to the relevant places. If we reach that stage, and that has been shown by cell tests, is that the media enriched with collagen hydrolysate clearly show that we have cells, also animal cells from cartilage, that these collagen enriched media stimulates the chondroitin to build up collagen type 2, and that is also clearly shown by the relevant data. What is the effective way of collagen hydrolysate extraction? So you have here a picture that describes that after the intake of collagen hydrolysate, it passes through the intestinal wall. After that, connected to the blood. We can say that within, and again, that is proved and published by my former dear colleague Stefan Besser, published in Cell Tissue and in Nutrition. This result that has been clearly shown by tests. So, intake of collagen hydrolysate will mean that the material, the collagen, will pass the intestinal wall. It goes within the next 6 hours into the blood to 95%. 95% will transport it within 6 hours into the blood, and after 24 hours, that can also show by studies to the relevant places, to that we had the pictures before, to the knee. And there, what happens if once the collagen hydrolysate goes in contact to the cartilage, you have it here, and the black dots are the cells, and that is the treatment of any cell test. That is the treatment of collagen hydrolysate of the cell. And you see here the brown part around the cells. That is identified as new built collagen type 2. That is more or less 75% in our human cartilage. When does administration or therapy of collagen hydrolysate make sense? So prevention is, of course, at least professional sportsmen, collagen hydrolysate as nutritional supplement during his exercise before and after the sports. Therapy is in case of persisting joint pain, in case of diagnosis of osteoarthritis, of course, then, and also the status of post-surgery of or injuries, and that it drives me to one issue. Osteoporosis is a very, very important other issue. That means bone. That is all things that are related to bone. There are some very promising results already available showing that also collagen hydrolysate has a good influence, or has an influence if people suffering from osteoporosis. Up to now, collagen hydrolysate, and to create awareness that this product that has to be considered, I have to mention it again, not as a medicine, not as a drug, as a health supplement with several other very, very important. 3 last points: dosage and period of administration. Again, 10 grams the daily consumption. That is, the figure has been clearly shown, underlined, and carried out due to experiences we have with our clinical data. 10 grams is a daily recommended dosage, and that need to fit into your general food you eat. You should not overload the protein content. Collagen hydrolysate should be administered for at least 3 months. To be clear, we got the feedback that people still need or consider an improvement of the pain of the osteoarthritis after 4 weeks. But all again, due to the clinical data, we have to convince the people that the administration should be at least done for a time of 3 months, and don't stop it afterwards. You have to consider it as a daily dosage. You have to consider it as a part of your food, of that what you eat.